A statement from the Prime Minister Robin Nabbanja indicates that Cabinet has set aside 1.3 trillion shillings for mitigating the second wave of the COVID-19 pandemic. This is 400 billion shillings less of the budget the Ministry of Health had presented before the Parliamentary Task Force on COVID-19. The funds include 114 billion for continuity of essential services, 808 billion for logistics, laboratory services 84 billion, case management 93 billion, risk communication 68 billion among others. Despite this allocation, Prime Minister Nabbanja says government is facing challenges in accessing the COVID-19 vaccines due to the huge global demand, especially from rich countries. Only 872,914 out of the 4.8 million high-risk population have been vaccinated, representing only 4% of the target of the 22 million of the eligible population.
The answer to this pandemic is vaccination. The only challenge we have is accessibility of these vaccines. Big economies that contributed during the time when they were developing vaccines had a debt to, these companies had a debt to clear with those big economies. And therefore for them they were given in big quotas. So we are still in line.
I want to call upon the government to explore all avenues to see that Ugandans are vaccinated, because this pandemic is really dangerous and it is taking people's lives.
Yes, we must do everything we can as a nation to have our own internal source of vaccines. And the government should speed up the process of creating internal capacity to make vaccines, because this may be just the beginning of future pandemics. And unless Uganda and Africa has the capacity to do their own internal vaccine production, we are going to continue having this crisis come down the years down the line.
Meanwhile, Nabbanja says government is negotiating with private health facilities to reduce their cost of treating COVID-19 patients. Proprietors of these facilities claim on average they spend 3.5 million shillings every day on each patient in the intensive care unit.
So that our people are treated in private facilities, either one, government meets the cost, or government helps waives on the exorbitant fees that the medical facilities are paying on water and electricity, utility bills.
Habad Ziwa, NTV at Parliament.